We're going to get started. My name is Kirsten Ochoa. I'm the marketing coordinator here at Libertana. And what our webinar is going to be about today is CalAIM and hospital and SNF discharge services. And basically just explaining what they are and how they're going to help facilities like yours. I know people are still jumping in, so we're just going to go and get started. For housekeeping, I know there's going to be a lot of questions that do happen throughout this presentation. If you could, please use the chat feature for any questions that you may have during this presentation. We'll open up at the end for questions, and any other questions that you may have will also follow up after this webinar. Alrighty, I just wanted to introduce a few members on our team. So firstly, we have Yanine. She is our HANDS program manager, along with her contact information. Denise Ambayak is our second member on our team. She's our marketing manager, along with Jared Music is our CCA program manager. So he runs mainly the ALW side of things. And then we have Gavi, which is our CalAIM program manager, and myself, Kirsten, which I'm the marketing coordinator. So we all work closely together to make sure that our CalAIM initiatives do work efficiently and smoothly for our clients' transitions. So what we're going to be covering today is basically what is CalAIM and how it impacts SNFs and hospitals, assisted living facility transitions. The acronym ALFT is what that stands for. How our Medi-Cal managed care plans fit into this process, eligibility and program rules, and then finally opening it up for questions. Our goal is simple with CalAIM. We are here to provide in lieu of the assisted living waiver and support families with timely and safe discharges. So the benefits for our SNFs and hospitals is that CalAIM is designed to help SNFs and hospitals discharge patients more efficiently by leveraging CalAIM services through Libertana. You can transition patients who are no longer requiring the skilled care of a skilled nursing facility and reduce unnecessary delays and keep long-term beds available for those who truly do need them. I did jump ahead of it. So kind of just going into like what is about CalAIM. CalAIM is a bundle of initiative services and support services for timely and coordinated discharges. Through our community supports and enhanced care management, we help patients provide smooth transitions from hospitals or SNFs to their next level of care, whether it be a community-based setting. So now jumping into what does CalAIM offer? We offer through our CalAIM is enhanced care management, as I mentioned, our assisted living facility transition service, respite and home care, and more. So getting into the core goals and patient benefits for CalAIM focuses on simplifying healthcare processes and improving outcomes through integrated collaborative care for patients. And this means just having better coordinate services that improve access and support and just overall higher quality of life for our patients. Ideally, we're trying to reduce the barriers and increase access for all of our patients to get a hold through these CalAIM services. So I know just in the home health space in general, we do throw around a lot of acronyms, and I know I have mentioned this acronym a few times within the last few minutes. But what ALFT does stand for is the Assisted Living Facility. It is a CalAIM community support, and this service helps prevent patients from moving into hospitals or skilled nursing facilities and helps them move into an assisted living facility type setting. And just reduces their extensive need for skilled nursing type care when they no longer need it. And moving them into assisted living facilities could be either ALFs, which is the assisted adult or assisted living facilities, a residential care facilities for the elderly, ARFs, which is adult residential facilities, or boarding cares. So it is very vast in our community-like settings they do cover. So covering our ALF, ALF service overview for SNFs and hospitals, we do have two different pathways. Um, the first pathway is our ALFT diversion, and this is preventing unnecessary SNF admissions. Our second pathway is our ALFT transition. So this is going to be helping clients move from a SNF or hospital back into the community. As I mentioned, community, it does fall under whether it be an ALF, an RCFE, an ARF, or a boarding care. So jumping into the scope of our ALFT services, um, our our purpose is to help Medi-Cal managed care plan members transition from a nursing facility to a community-based assisted living setting. And as I mentioned prior in this, this is in lieu of our assisted living waiver. And what that means is that we're helping clients tap into services now and tapping in through their managed care plan, and they would be the biller uh, who's going to be covering the expenses compared to having to wait on the wait list until their name reaches the top through ALW, and then Medi-Cal is the payer at the end. So that's what they mean in lieu of the assisted living waiver. So it's just allowing clients to access now with very similar services, but having just a different payer until they receive the full benefits through the Department of Healthcare Services. So kind of jumping, ALT does include coordination, transitional care planning, access to community resources, and it's all aimed to improve outcomes and stability for our patients. So I know you're probably all thinking like, oh, this sounds all great. And I have a few clients in mind who actually would do really well with the service. How can I submit a referral and what does that even look like? So our referral process is first you'll submit our referral or you'll submit a referral and submitting a referral with an available member when discharge information. This allows our team to quickly review the eligibility and assign a transition coordinator. So definitely having that information readily available is going to help not only you, but our team get you the answers quicker and more efficiently. Going into that, just having information available. Once you submit that referral, we will connect with you and gather more details. So this kind of then takes on our transition coordinator then takes on the next steps by working with the client, gathering additional information, whether it's going to be clinical, functional, or placement details, and then just determine what's going to be the next best steps for this client. After that, we set a plan and request authorizations from the client's health plan. So before a client can transition, we check in with the transition coordinator, and this ensures that the alignment and the discharge timing, the placements, the readiness, the authorization, and the outstanding needs are all in check, and it helps prevent any delays or disruptions. So definitely working with our the managed care plans and our transition coordinators to schedule all those things out are going to be key in having uninterrupted and efficient transitions for our clients. And then once everything's cleared, our ALFT service can begin. And as I mentioned prior, with Libertana, we don't stop just at the transition. We do continue our ongoing care coordination, and this kind of jumps into our enhanced care management, where we do those monthly check-ins for our clients who have been transitioned. So sending a referral, there are a few ways that you can send a referral. We do have our QR code up here in the top right corner. And at the end of this, everyone will be getting the slide deck. So you'll have access to this QR code. But if you don't like using QR codes, then you can email a client that you have in mind at our info@Libertana, which Denise and myself both oversee that email. So we'll make sure to get you connected with the appropriate team members to take on that referral. Or if you just prefer to be on the phone, we have our 1-800-750-1444 number. So whatever mode you like to contact us, we would like to help you in any facet available. And as I was mentioning, definitely just being prepared is going to make things go faster with anything in like services like this. So if you could, when you do submit a referral, if you could have this information available, which includes our face sheets, our med list, our HMP, the patient's HMP form, a power of attorney form if they have one. Confirmed income required, doesn't matter the source, just kind of knowing what their income looks like. This is going to usually be once you've already established contact with us, but our Libertana consent forms, and then confirming the date and location of the discharge. It isn't required, but it definitely does help. Alrighty, so now jumping into the ALFT finance structures, I know I kind of dabbled in mentioning it a little earlier in what in lieu meant for ALW. But what is the patient responsible for paying? The patient obligation is paying 90% of their income and keeping 10%. Facilities bill Libertana based on the managed care plans rates. So like I was mentioning, through the ALF reimbursement, it's going to be based on the managed care plans we're contracted with, their rates compared to the Medi-Cal rates under ALW. So eligibility and requirements for ALFT services and just program rules. To qualify for ALFT services, individuals must follow these two criteria. They can either be from a hospital, skilled nursing facility, or at home or homeless. And the key with our second rule is that they have to be with a managed care plan that we're currently contracted with. And these are our current managed care plans for our SNFs and hospital patients that we're contracted with. We're currently contracted with LA Care, Anthem, HealthNet, and Cal Optima. Um, and with these, our managed care plans play a vital role in coordinating care and residential or skilled nursing facilities and hospitals. At Libertana, we partner closely with our managed care plans to ensure and receive the right services while maintaining clear communication across our care network and to promote safety and wellness. Through CalAIM, an umbrella of our initiative programs, we can meet nearly all of your discharge needs and helping patients transition smoothly and successfully. So all of our managed care plans want to ensure in coordinated care and smooth transitions for our clients. Now getting into kind of some specific rules with some of our managed care plans. And that's what's going to be like the biggest difference between ALW, where we used to work with, now working under CalAIM, is that instead of having just one general rule that was under DHCS and like Medi-Cal requirements, now we're working with managed care plans where they are kind of working on the same field, but things may look a little different per each managed care plan. So for LA Care and Cal Optima, there is no 60-day requirement to be in a SNF. As soon as the client is admitted and no longer needs a skilled nursing level of care, they can apply for ALFT, which is our CalAIM service. For HealthNet, a SNF referral must meet at least 60 days. And then with hospitals, they don't need the 60 days, just with a justification letter of approval. And then with Anthem, they do need to meet the consecutive 60-day requirement to be in a SNF to apply for CalAIM. So now jumping into like what an ideal client would look like for this service is we have Mr. L. He is a 74-year-old Medi-Cal LA Care member who was admitted to a SNF rehab and no longer needs skilled nursing care. He lacked the social support system and needed help finding an assisted living facility setting. So his challenges were that he was trying to find he was trying to find a SNF long-term bed, but he didn't need it, and he lacked a social circle and relied on SNF's social workers and discharge teams to find an assisted living facility that better suited his care. So where our role steps in is that his SNF team has contacted us and we coordinated with his health plan, identifying an ALFT approved facility and managing his entire transition. And we also confirmed his financial responsibility, which is paying that 90% of his income. And then for the outcome that for Mr. L is that we transitioned him safely into a supportive, affordable environment, and we continue to monitor his case while awaiting an ALW slot. And the SNF has freed up a long-term bed care for someone who truly needs it. So I know we mentioned that we're going to open it up for questions, but we did anticipate that some of the questions you guys might ask. So we're going to go through some of the anticipated ones, and then again we'll open it up for further questions if these anticipated questions didn't answer everything you guys were looking for. So our first question we anticipated is, can a client transition when I send you the referral? So no, they can't. We must obtain authorization from the health plan first. This is not like ALW. Um, our CalAIM ALFT does require approval before the client does move. So our next question is Medi-Cal, for Medi-Cal managed care plans. We ask members and their point of contact to check in with our team before considering a change of a Medi-Cal managed care plan. And the only reason we do want to consult first is that a change may result in ineligibility or termination of an ALFT and discharge service with Libertana. So our next question is, can clients move into an assisted living facility setting? No, only it's not any assisted living facility or boarding care. They do have to be specifically a CalAIM approved facility. And if you are a facility and you're interested in CalAIM, definitely reach out to us at info@Libertana, and Denise and I can help you with becoming a CalAIM provider if this is something that does interest you for our assisted living facilities here on the webinar. So I know this could be the big question for everyone, but questions about billing. So if you do have any questions related to billing, we do ask that you please reach out to our ALFT invoices at libertana.com, and they'll be the ones to guide you through any financial or billing type inquiries that you do have. So I know we mentioned how to submit referral. This is also a link to access the referral portal, as well as you can email us. I know we've given a lot of different things that you can access to, but the best way, and I think the easiest one for most, is going to be the emailing. But if you're very tech savvy, definitely use the link to get started. Which is going to be a fillable form. And as mentioned, if you have as much documentation to prepare in advance, is just going to make the process go by faster. And as mentioned before, these are going to be the documents that you would want to prepare just to have a more efficient referral process. So in our last webinar, we did receive your feedback, and this is how we're improving our CalAIM services. So more staff equals more dedicated coordination. So we are hiring additional transition coordinators who can spend more time focusing and time collaborating with you on our discharges. This just means more frequent communication, faster processing times, and assessment and smoother assessments and transitions for our shared members. proactive case collaboration meetings. So you can take advantage of the support by requesting case meetings with your assigned transition coordinator, and they're happy to go over a brief stand-up meeting with you and your team to review mutual clients, aligning on discharge plans, and sharing real-time updates. We want to keep communication as seamless as possible, so we've really taken it upon ourselves to extend that olive branch and be as transparent as possible with our communication and education. And we did hear about just overall lead time, so we are focusing on faster referrals. Using the referral links to quickly send clients our way. This helps gets cases assigned to our team as soon as possible, so coordination can begin without delay. As mentioned in the previous slides, if you're ready to refer a client, use the link here or email us at info@Libertana. And then ongoing updates and engagement. We'll be hosting bi-monthly webinars to share updates on our services and processes and staffing to stay connected with you and for what you need. So we do appreciate everyone's time here, and we would love to hear just more about how we can continue to service you guys and just anything that you would like to see in the future. We would love if you would fill out the survey just so we can better tailor our upcoming bi-monthly webinars, along with just seeing if there's any tech issues that we can improve in the future. Your feedback does mean a lot to us, and we would like to continue to share that communication with you guys. So now I am going to open this up for questions.
So I'm going through the chat and some of the questions that did come up, and I'm just going from the very top with down. A question that came in was if we have residents and they are already in the RCFB, could we refer them to you? I think, you need to correct me if I'm wrong, I think at this time, the Medi-Cal managed care plan, specifically LA Care, HealthNet, CalOptima, Anthem, they are not taking clients under Cali who are currently in your assisted living facility or your boarding care at this time. Another question that did come up. Yes, this session was recorded, and yes, we'll be sharing the presentation material after. Another question that came in is Cal AIM a replacement for the ALW program? If not, how is Cal AIM different from ALW? So Cal AIM is kind of like the interim program. Cal AIM is what members can tap into now, assuming that they have a Medi-Cal managed care plan. And they remain on the ALW waitlist. So you tap into Cal AIM now, and then you get enrolled into Cal AIM later. And another question that came up, Libertana can bill for Medi-Cal clients with ALW, and this came from Catherine. Catherine, I'll go ahead and maybe just restructure this question. We take on clients who have either straight Medi-Cal or a Medi-Cal managed care plan. It's usually within the client's best interest to get into a Medi-Cal managed care plan because then you have access to these kind of services now, whether the client is in a skilled nursing facility, a hospital, or even at home living with their loved ones, they can tap into this particular service. They then move into an assisted living facility that is greenlit as an Cal AIM provider or a Cal AIM facility. And then the Cal AIM facility will then send invoices to Libertana, and we will pay the facilities on the Medi-Cal managed care plan's behalf. We do plan on drilling out that information in future webinars just to kind of showcase what the billing process is downstream. Another question that did come in was, how long does it take to get approved when in the hospital and SNF versus home or homeless? Janine, do you mind answering that one? I know it's pretty fluid right now.
Yeah, so the approval times are really going to vary by managed care plans. Currently, we're seeing about a 5 to 7 turnaround time per auth from LA Care, HealthNet, and CalOptima. Anthem does have a longer wait time, so it does vary. So it really depends on the managed care plan the client's enrolled under.
Thanks, Janine. Another question that did come in, is there a chance that Libertana will be contracted with Kaiser?
So we are in communication with other managed care plans to, see if we can get contracted with them. As soon as we have more information, then we will definitely share that with you all.
Another question that came in, I thought LA Care is not accepting new Cal-AIM enrollments. Also, is there a way to make the hospital enrollment faster? They can't wait until the time that it takes to enroll the patients that they are looking to discharge.
Yeah,
So,
so we are still actively enrolling clients that are under LA Care. As mentioned on this webinar, we are really restructuring our process to allow for more timely and quicker transitions. And so one of the areas of that is hiring on more staff to accommodate for that.
another question that came in was, please provide information for submitting an application for residents insured with CalOptima.
The referral process is still the same. You can use the referral form that was mentioned on this webinar. There has been a slight difference within the process through CalOptima. So now with CalOptima, there is an initial approval, which will require that there is a nurse assessment that takes place. And then now CalOptima is requiring that the client move into the facility, that we confirm that the client has transitioned and is currently in that RCFE. And then a second authorization is submitted for wraparound services.
And can you define what wraparound services means for those who don't know?
Wraparound services is the authorization that will allow you to bill us for the services that you provide.
As an RCFE, correct?
Correct.
Thank you. What managed care plans are we contracted with that allows Cali-AIM in Riverside County? So I think they're asking if we have any Medi-Cal managed care plans in that county.
Currently, we are not contracted with any managed care plans within the Riverside and San Bernardino counties. But again, we are in communication with most managed care plans that we're not contracted with. If there are any changes, we will definitely let you know.
Another one came in, any Medi-Cal managed care plans that we're contracted with in Santa Clara?
For Santa Clara, yes, we do offer services for our Anthem population.
Okay, we'll take a few more. I'll take this one you need. How can a facility become a Cal-AIM ALFT approved? If you are an RCFE on this call or a board of care and you are interested in taking on Cal-AIM clients, go ahead and reach out to us at info@libertana.com. We'll go ahead and take your inquiry and we'll make sure that you get directed to the team who can provide you with information and the contract to take on Cal-AIM residents. Janine, I may need your help with this one. Is the transition from Cal-AIM to ALW automatic?
So no, it is not automatic. There will have to be an application submitted for ALW services. Once their slot is released, whichever CCA submitted that client to the waitlist is responsible for submitting an application to DHCS.
Oftentimes, clients who do get referred to us for the very first time for Cal-AIM, one of the things that us as Libertana will need to do is, again, submit a separate application for ALW to capture enrollment when they reach the top of the wait list. Okay. If Cal-AIM accepts 90% of the client's income, does that apply to clients not eligible for SSI, like those who are on GR or CAPI? And if so, what happens when they need to transition to ALW? Will they instead be allowed to stay with Cal-AIM on that reduced rate?
So the income requirement really depends, again, per MCP. Those clients that are not eligible for income, we can help with providing a justification letter. Again, the RCFE has to acknowledge that they're not going to be receiving any room and board from that client, and they're okay with just receiving the standard rate per tier for that client. Now, same thing with ALW, right? Where it's understanding that the client's not going to pay any rent towards the room, but you can bill off of the services that are provided under ALW.
Another question that came in, can we send referrals to enroll in Cali for residents residing outside of LA County, such as San Diego, Sacramento, and San Luis Obispo? So in this slide deck, Beatrice, we do have a breakdown of what Medi-Cal managed care plans that we have. We'll be sure to include what counties those encompass, just for your reference. Because it is more so dependent on Medi-Cal managed care plan, and then also kind of every Medi-Cal managed care plan covers different territories. So we'll be sure to distill that down. Another question that came up, we'll take a few more. Oh, does a resident at a skilled nursing facility under Cal Optima have to wait the 60-day period before applying for the CalAIM waiver or fair CalAIM services?
I'm sorry, Janice, that was for Cal Optima, correct?
Yes, correct.
Okay. Yeah, if the client has not met the 60 days, they can apply under the diversion portion of their services.
And for those who aren't aware of diversion, can you explain what that means?
The diversion portion, it was mentioned on the slide deck, but basically it's to divert them from going into a skilled nursing facility. So it can apply to clients that are in the hospital or in the community.
Okay, we'll take one more question. In counties like, and this is from Camille, in counties like Los Angeles, we're able to take in residents under CalAIM. But in places like Orange County and San Bernardino, we have to wait until fully approved. Do you see that changing anytime soon? So I think this person is asking if we plan on going into other counties.
Yeah, so we are, as mentioned, in communication with some of those MCPs to really try and get contracts. And as soon as we have any updates, we will definitely share that information with you all.
Okay. And we'll just take one more. Which health plans accept residents with no income?
Sorry, repeat that again, Denise.
Which healthcare plans accept residents or applicants with no income?
So again, without income, we have Anthem, who will, again, we might have to provide a justification letter just to acknowledge that the RCFE is okay with not receiving that income for rent. With LA Care, they are a little bit more strict. They do actually require the clients to have some sort of income. Again, we can try to provide justification to LA Care. HealthNet, you can apply, clients can apply without income. And with Cal Optima, it's unsure. We just provide the justification letter and then wait for the approval.
Thanks, Eugene. I'll go ahead and just take this one last question. It's in he mentions ALW applicant did not go through. Can they apply for ALW? They are straight Medi-Cal. Basically, the name of the game with CalAIM is Medi-Cal Managed Care Plan. It's really within the best interest of the member to get assigned to a Medi-Cal Managed Care Plan if they want to tap into these type of services. If they're just straight Medi-Cal, they only have access to the assisted living waiver. So they miss out on utilizing CalAIM, which can happen now, rather than ALW, where you have to wait about a year, 2 years, if not more, to get tapped into services. So if you have any clients, residents, patients in mind who need to tap into this service, Medi-Cal Managed Care Plan, get them onto one, and we can go ahead and take them on under CalAIM in a pretty expedient process. And again, just as Yanine and Kirsten had mentioned, we knew the demand for CalAIM would be large in scale. We just didn't anticipate it being as large as it was. We've been able to transition a significant amount of clients within less than a year. So Yanine and our operations team are actively working on taking are staffing up to the demand. That means hiring on new transition coordinators, new nurses. We heard that, you know, timeliness has been an issue, so we're trying to get ahead of it to staff up according to the huge demand that we saw for this particular service. So we do appreciate you guys attending the webinar. We knew that there were questions in here that we were not able to address. This is the contact information to get a hold of myself, Yaneen, Kirsten, and others within our team. So feel free, if we did not get to your question, email us at info@libertana.com. We'll go ahead and address it from there. And be on the lookout for emails from us in the future. We're going to be holding these webinars every other month. That showcases a different CALI service. So today we put a spotlight on our assisted living facility transitions. Next month we'll be spotlighting our respite and caregiving CALI service. So if that's something that you're interested in, be on the lookout for an invite. But we really want to thank you guys for taking the time. You know that you guys are busy. We'll be sharing the presentation recording, all of that, so you can refer to it. And if you have any questions, again, this is our contact information. But thank you so much, and we'll look forward to speaking with all of you soon.
Thank you guys. Have a great rest of your day.